We do. Got it. Thank you. Okay. So we are recording, and again, no judgment. We are just happy that you're here. If you're having a bad hat day or a bad background day or whatever it might be, stay with us anyway. We don't care. So you are at Senior Roundtable. Great to see everybody. Thank you for joining us today. Very much appreciated. And again, hopefully, we always hope that the meetings are beneficial to you for multiple reasons, not only just the networking, but also, of course, the topic, this one being about as important as you can get for this. So we have one more meeting left this year. You can see that there on November 3rd. We will come up, we do their planning in December for the 2024 dates, and we are hoping to have January's meeting in person. So you'll hear more about that as we get closer. We also have a LinkedIn group, and we'll put that in the chat box here shortly. You'll see that in there as well. So who is everybody that is involved with these Senior Roundtable meetings? So my name is Laura Steigelman. Let me put everybody up here. My name is Laura Steigelman. I have been the very proud facilitator for Senior Roundtable for 15 years. And I know you're thinking that's impossible. She only looks like she's, I don't know, maybe 22, maybe 23. She looks old enough to drink, but yes, it is a true statement. So it started 15 years ago from the Community Foundation that you can see there. And what happened is Kathleen Shaw was starting to, there's an organization starting to get grants out to elder focused initiatives and organizations. And she realized as she was getting to know the community and who did what where, that a lot of them didn't know of each other. So they started the Senior Roundtable as a networking group and an opportunity for folks to learn about an important topic, and the topic changes every meeting. So that is how I got involved. I love what I do. This is my very favorite meeting every single time. I always look forward to these. Elder Source, Gabby, I don't have all my videos open, but if Gabby is here and Andrea's here, if you're an Elder Source person, if you'll give us a wave. We got a few Elder Source folks on here today. If you haven't connected with Elder Source, they are the go-to. They are just everything that you could ever want to know about what's happening in the elder sector, etc. And our liaison is Gabby, who puts all of the emails together, the fancy emails, the email invites, all of those things. She'll send the post-meeting recording out with handouts and things like that. That's Gabby. And then Andrea helps her out behind the scenes as well. And the Community Foundation is why we're here today and why we get to continue to be here. So if you are not on Zoom all the time, like some of us, a couple little things about Zoom. As you can see there, the video helps a lot. We don't care if you're the picture on the left or the picture that's really the suave looking dude on the right. We're just happy that you're here. And if you're in a situation where you're willing to turn your camera on and you've got that technology to do that, we love it just from the facial expressions and the head nods and smiles and things like that. So that's a plea to the masses if it's possible for you to do. Zoom ruler along the bottom of your screen. That's at least that's where I kind of hide mine. Bottom of my screen, there's this little black line, and on that you're going to see a mute, a chat, etc. And if you'll click on chat, you'll see that the Zoom producer that's with us, helping us out behind the scenes, that it is a way for us to kind of communicate with you, or you communicate to us or the speakers. So we'll use that chat as we go through the information here. And you can see Pamela has got something in there. And actually, I'm going to give credit to Gabby, who knew that it was suicide prevention awareness. She pulled all those stats together and put that together. So yeah, it was good timing for this month to really focus on what resources are out there for folks who are in crisis. So if you want to put your name and your organization on your video feed where your name is, or if you've got someone else's name because you borrowed somebody's log on or something like that, you can do that. And I think that the Zoom producer has put that information in the chat box of how to change that name. So you've got that also. This is recorded. We'll stop it a couple times when you're in your networking meetings, just because it's just me and here by myself. Nobody wants to see that on a recording. So once you're in your breakout groups, we'll stop it. We'll start it again when the program's there, and we'll put that on the YouTube channel that we have for Senior Roundtable. Next week, you'll get a notice that that has happened. So you'll see that again if you want to, or if you want to forward it to someone else. So who is Senior Roundtable? I mentioned how we got started 15 years ago, and we meet every other month. Everybody is welcome. In fact, we encourage anybody who's willing and able and interested in coming to join us. It's also a great opportunity to network. And again, we always pick a great program that we think would be helpful to those who are attending the meetings. And our goal is to be collaborative with others. You know, who's doing what? How do we help each other? How do we support each other, etc. So great agenda today. We're really excited about that. We're in just a second going to hit organizational announcements. And our meeting sponsor today, Michelle, is with us from Millennium Physician Group. She's going to have a couple of minutes on the calendar here shortly to tell us about her organization as a thank you for being willing to sponsor. You'll get a chance to do a couple rounds of networking with those shiny, smiley faces that are here with us today. And you can see the topic and the speakers. And again, thank you all to the speakers for giving us their time today to join us and share about resources and anything else in this category. We're happy to hear it. And then for meeting sponsor, the meeting sponsor has given us 2 door prizes, 2 $25 Amazon door prizes. You have to be present to win. And we do that at the very end of the meeting. So you'll see that as well as we wrap up today at 10:30. So if you have any senior sector announcements that you think that would be important for this group to know, Diana already put something in the chat box, so you can see that as a perfect example of that. You know, come to our celebration at such and such, here's the information, here's the link, etc. And feel free to do that throughout the entire meeting. And also feel free, there will be some folks that you don't get to meet perhaps just because of the breakout rooms, you know, are limited intentionally to give you time to talk with each other. Feel free to do your introduction also in the chat box for each other, part of that networking. And also, again, any events, announcements, anything coming up that you think would be helpful for others to know, please feel free to do that. Those same kind of things can go into our LinkedIn group, and you see that there, and the Zoom producer has put that information in that chat box. So if you're looking for us on LinkedIn, that is how it's categorized. There's another senior roundtable out in California. The people kept trying to join ours. We said, that's great. We love it that San Francisco is interested in Northeast Florida, but it probably is not what you're looking for. So we wanted to make sure it was really clear for those folks that it's Northeast Florida area. And anybody that is wanting to come in absolutely can. And you'll just do a request to join the group. I'll see that and we'll get you set up. And it's just a nice way to, if you meet somebody here and you forgot to get their contact information, hopefully they're in that LinkedIn group and you can find them that way as well. So you've got that as an option. So from our meeting sponsor, when you're a meeting sponsor, you get 3 minutes on the calendar. I'm sorry, the schedule, the agenda today. And then also, again, we appreciate the 2 $25 gift cards at the end of the meeting. We'll draw for those names at the very end. So Michelle, I'm going to stop speaking. Set your timer if you're willing to, just so I don't have to jump in. And then it's all yours.
Well, thank you so much, Laura. I absolutely will not take up 3 minutes of your time this morning telling you about Millennium, although I do like to talk a lot about Millennium. I hope you guys can hear me okay. I'm in my car, and like I heard you say, Laura, that the storms, I live in Jax Beach, and they came through and it was like crazy loud. So I left the beach and now it's beautiful in town. Meanwhile, hello, everyone. So great to see you at a senior roundtable. I'm excited to just kind of update you on Millennium, let you know what we have going on and what we have coming up. We are a primary care physician group here in Northeast Florida. Actually, we're in 18 counties across the entire state of Florida. We're in Austin and in Raleigh, North Carolina as well. Over 800 providers to really start taking care of you, your family, and your loved ones. We don't only see the patient that's 65 and over, we see the whole patient. We see the caregivers. We see the family members that are also needing assistance, and their healthcare really needs to be monitored. One of my favorite things is like, I have a primary care doctor that I like. I'm like, that is so great. As long as someone is taking care of your healthcare, it doesn't have to be one of my doctors. But what we do offer here in Northeast Florida, we have an endocrinologist, so we do have a little bit of specialty care as well. What is new with us? Well, we have been really focusing on the upcoming annual open enrollment period. It starts on October 15th. It's that time of year that brokers and agents will call their Super Bowl. For us, it's just making sure our patients are well taken care of, that their Medicare questions are answered, that they are able to really get the help that they need. For brokers and agents across the entire area, we have a new feature on our website for broker and agents to go directly online. And it really gets them to a point where they can put in a patient, they can schedule a patient. All of this is done online. So that's really exciting that we have to offer this year. But that's not just for brokers and agents. That's also for you and your family. You can always go online, schedule an appointment. Another cool thing that we have that's going on right now is we just opened a brand new state-of-the-art facility up in Fernandina Beach. It's in the old movie theater, if anyone's familiar with it, on the island. It's primary care, It's a walk-in clinic that's open from 9 a.m. to 9 p.m. That's every day. And it also has lab and radiology, including CAT scan, bone density, 3D mammography, regular mammography, ultrasound. It's insane. You do not have to be a Millennium patient to use the walk-in or the lab and radiology. You just need an authorization from your specialist or primary care. Otherwise, we have same-day appointments available. We have walk-ins available at about 7 of our area locations. I will try to add a location flyer in the chat just to kind of give you an idea of where we are across the 5 counties, but I'm always available. I'll include my email and my phone number in the chat as well. Laura, thank you again for this wonderful opportunity. And I'll have to drop off the call shortly, but I look forward to sharing Amazon gift cards with those lucky winners later on today.
Michelle, thank you so much. And even after the meeting today, if you're back to, computer or something and you have something you want me to send out on your behalf,
okay,
contact information in addition to the chat box, if you're able to do that, please do. But we can also include whatever you need us to in the post-meeting email that will be sent out by the Gabby. So
perfect. Thank you so much.
Right. Safe driving. Yep. Hopefully the storm does not catch you again.
No, I'm in a parking lot. It's safe here. I think there's a big tree. Okay.
Thanks, Michelle. All right. So we're going to say, who's here? What are you doing? Where do you work? What are you up to, etc. So we're going to head into a networking opportunity and we'll do a couple of rounds. You'll see here, this is what we're going to be doing. And with that, let me get everything up here for you. So when you're in your networking group, here's what you're going to see. Again, for those who are on Zoom all the time, apologies because you know this in your sleep, but we're going to send you automatically in your breakout group. There will be a timer, a little tiny timer at the very top, hard to see, but that's where they have it. And it'll count down for you. I think that the Zoom producer has it set up for 7 minutes, and then you'll get a 60-second countdown and it will bring you back automatically to the big room. Room leader, whoever has that next birthday, we're going to ask for you just to kind of monitor time. You don't have to report out or anything like that, but just make sure that if you're at the 6-minute mark and only 2 people have had a chance to talk, please feel free to be that kind of person that says, hey, we kind of got to move it forward so we can get everybody in there. So your kind of real goal is just make sure everybody gets a chance to talk and share before it's over. Anytime you're in a breakout room, if your system is up to date, sometimes if somebody hasn't updated their system for a couple of years, they can miss some of these little things that Zoom allows us to do. But once you're in the breakout group, you should be able to click on that chat box and it will come into the breakout group with you with the instructions. But just in case you don't have anybody in your group that can do that, I'm going to share this slide in the breakout room also, so you have that. So please share name, where you work, if applicable. We do have people come to the meetings that are just interested in the elder sector. They may volunteer, they may have a parent, they may be the elder themselves, as a few of us, speaking for myself, may be. So whatever that reason is, we're happy that you're here. And then if you're with an organization, what do they do? Just so others know. And then favorite holiday and why. And then we will bring you back again automatically at the end of those 8 minutes after that 60-second countdown. So we'll see you back here then. Let me pause for just a second. Let me move everybody back over. Any questions before we hit the send button? Okay, Zoom producer, I think we are ready. A question. And Zoom producer, thank you I always forget the recording. So that's why I can't be trusted to do this by myself. And I'm smart enough to realize I need a second person because of my ineptness. So show of hands, did you meet anybody that you did not know before? And if you choose not to, or you don't have your camera on, feel free, you can use the show a hand at the bottom. That's awesome. And did anybody make a contact that you are going to follow up with at some point? Anybody? I'm seeing Kathy nodding her head, a couple folks nodding their heads. Maia. So sorry. And so that is what this is all about. And again, feel free in that chat box as we're heading into the program, feel free to, if you have not gotten a chance, because you wouldn't have because of the numbers, feel free to put your contact info in that chat box, where you work, etc. If you got an email, phone number, whatever. Don't forget about the events. We're just going to keep it rolling as we go through. If you think of an event or announcement or something that your organization wants to share with others, and you saw some good ones in there already. And then also for some folks, I saw that you have added your organization. for anybody, please feel free to do that. And the way you would do that is just hover over your own picture, and you can do the 3 dots, which is the rename. If you want to add where you are working, what that organization is, please feel free to do that. Certainly don't have to. It is an option if you want it. So we are moving on to our program today. We're so appreciative, and as you saw in the chat box a little bit earlier, and in Gabby's announcement when she sent out the email invites, Gabby again with Elder Source, she was reminding us that it's Suicide Prevention Month. And for the 4 speakers that we have here today, this is the space that they've got those resources, they've got the knowledge, etc. So we're really grateful to have this opportunity for them to share with us. We're going to also put the information of who the 4 speakers are in the chat box. And I think Zoom producer, you've got that in your materials. So if you're like, okay, I forgot, where does Claudio work? How about Felicia? Where is Felicia from, etc. So I'm going to stop sharing my screen in just a second. And so for each of the presenters and the speakers, if you'll do your own introduction, what do you think is important for folks to know? Tell us about your organization, and then all of those different things that you think is going to be helpful for us to know under this topic of mental health resources in a crisis for seniors. And then you see Felicia is with the VA. Of course, we have a lot of veterans that fit absolutely into that category, et cetera. And they've got some great resources also that can help everybody, including, of course, our senior sector. So with that, I'm going to stop sharing my screen, and Maia, you've got the comm.
Thank you so much. Let me get my PowerPoint up here.
And speakers, if you'll please, just as Maia's getting set up, we had the program completely ready to go, and then we found out about Felicia. So we've added her at the very end because we wanted her to at least have a couple minutes on here. So for each of the other speakers, if you'll please set your timer for 15 minutes. And then Felicia, I'll remind you as you get started, but you have until the 25-minute mark, 10:25, and then we do a wrap up and our door prize and things like that. So I'm going to stop talking again. And Maia, you've got it.
Great, thank you. You guys can all see my screen all right? Perfect. I'm going to try and give you guys a really thorough view of what we do at Here Tomorrow in the time that we have today. So my name is Maia Savage. I'm our outreach and collaboration coordinator here. So my job is really sharing with people like you guys in our community what we do at Here Tomorrow and how you can utilize us as a resource, not just for the senior community, but really for any adults that need some support. So I'll go over what we do, and let's see. There we go. Okay, I'm going to go over what we do here at Here Tomorrow, why we're here, a little background, and then how do we help? Who can we support? And then how do you reach out to us? So we are a nonprofit organization reimagining suicide prevention by providing real support to those in crisis without barriers. So really what we're doing here is trying to take the barriers off the table that people traditionally experience when they're in a moment of crisis. We do that by providing no-cost, same-day peer support, because generally those 2 main barriers people face are cost and time. That time aspect being, a lot of times it takes weeks, maybe months to set up an appointment with a licensed mental health provider. So we're really here to fill that gap and take those barriers off the table so people in crisis can get support. Our mission is to transform lives by building a community where suicide prevention is accessible without barriers. Again, making sure people get the help they need when they need it. Everyone wins when all community members in need can access mental health care and live full, meaningful lives. Everyone has been touched by mental illness and suicide in some way, whether it's your own personal story, someone you know, someone you care about. So really, we're trying to be here to make our community better for everybody. In 2021, 12.3 million adults seriously thought about suicide, 3.5 million adults made a suicide plan, 1.7 million adults attempted suicide, and over 48,000 Americans died by suicide, to give some gravity to the problem we're facing here, and why organizations like Here Tomorrow and other people doing suicide prevention, it really is needed, not just in Northeast Florida, but all over. This is a really very large issue. That's 48,183 more people than should be dying by suicide. And the problem is not getting better. Provisional data for 2022 shows over 49,000 Americans died by suicide. So that is an increase in the number of lives that we've lost to suicide. And obviously we would like that to be going in the opposite direction. Specifically, people ages 85 and older have the highest rates of suicide. And if we look at that percentage change again from 2021 to 2022, we see they also had the highest percentage change. So that is a community that is, as I'm sure a lot of us here are aware at the Senior Roundtable, suffers from a higher risk of suicide, clearly, given the data. Why? Loneliness, grief, loss of freedom, chronic illness and pain, cognitive impairment. A lot of these are reasons why that the elder rate for suicide is so much higher. So, at Here Tomorrow, while we are here for everyone, we certainly recognize this is an at-risk population, and we have a lot of resources to be able to give to those that reach out to us who are part of the senior population, so we can fully support them and understand, these things that are going on in their lives that I've listed here, among other things. But really, this is, we're here for everybody, like I said, trying to get rid of those barriers, but we know this is a group that needs a lot of support specifically. So this is a little graphic that really just shows kind of how we're filling a gap that currently exists. So when you're in crisis right now, at any age, you kind of have two options. You can call 988, which is crisis support right now, but you still wake up tomorrow and now what? You're in kind of the same position. It can be helpful in the moment though. Or you can try and make an appointment, on average 6 weeks later, if you're lucky, if you find someone in your network and you can pay for it for that clinical support. But again, you wake up tomorrow and you're in that same position. So these are our traditional suicide prevention and mental health efforts. And there's this big gap in between of this time people have, that there's not support for. So we're trying to fill that gap. So you can reach out to Here Tomorrow when you're in crisis, and we provide support in the moment, but we continue to support everyone for a full year. So you wake up tomorrow and we're still here for you. In a week, we're still here for you. In a month, we're still here for you. In a year, we're here for you. So we're really trying to make sure people have that continued support and they can feel the consistency in the team of people behind them. Our founder is Joe Kenny. This is from a news article, that came out when Here Tomorrow was published. And Joe was a very connected businessman in the community. He kind of knew everybody, and he still was not able to find support for his son Gary when his son Gary was severely depressed. And unfortunately, Gary did take his life, and Joe wanted to create a place that Gary would have gone to find help, that would have been a place that people just listen and he didn't feel pressure, and also a place where Joe could have gone to find support for his son. And so really that is why we are here at Here Tomorrow. This is where we come from, is trying to be a place not only for those that are in crisis, but for those that have a loved one in crisis, to find support and to find the access that they need, without any barriers at all. And really this is Gary's legacy, and we're here to help people like him and like Joe. So how do we help? So the number one way we do that is through our peer support, and I'll go more into what that entails. We have funded therapy and resource connection to other partners, support groups, and we engage the community in conversations and suicide prevention training. So what is peer support? It provides non-judgmental, safe space to support and inspire others through shared understanding, respect, and mutual empowerment. So really at the core of this is all of our peers have lived experience. They've been in recovery from mental illness, substance abuse, other life struggles for at least 2 years. So everyone that reaches out knows the person they're connecting with gets it, has been there, and is not going to judge them. We are non-clinical. So these peers, they cannot prescribe, diagnose, they're not licensed mental health providers. They are here to, like it says, like I said, be a safe space, be someone who gets it, who can listen, who has been there, and can say, I understand you're hopeless. I've been in a similar situation, but I was able to make it through that and find hope again. And let's figure out what you need to find hope again. What do you need in your recovery toolbox? And really, these are kind of the tenets of that peer model. It's recovery oriented. Like I said, we're trying to build a recovery toolbox for them. It's not just crisis support. It's what do you need here to be successful moving forward? And that's why we stay with everyone for a full year. Things change. You may need a new resource in 3 months that you didn't need today, and we can add that to your toolbox. Person-centered. It's based on each individual person. If there was one standard recipe for mental health success, then that would be fantastic, but that's not the way that it works. Everyone needs something different, so it's centered around each individual. It's voluntary. People come to us and they are here by choice. We're not forcing people into our peer model. They're here because they are trying to work on their own mental illness. They reach out because you know, there's something in them that wants to be here and wants to find hope again. And it is relationship focused. Again, it's based on that peer being able to connect with them and say, I get it, and trauma informed. So we want them to be safe and empowered. Our peers are all trauma informed, you know, in the way that they provide peer support. They've all experienced trauma themselves. So we're trying to make people feel as comfortable as possible. The people we support are called friends. So we don't call them patients or clients. We call them friends because we are non-clinical. We are different than a lot of, you know, the kind of support people have seen in the past. And if you enroll as a friend, the peer team supports you for a full year. So like I said, you know, that's 365 days of support, all at no cost. And during that time, we really just continue to provide that space for people so that they, you know, continue to know that they're not alone and can connect them to other resources such as funded therapy. So that funded therapy program is for friends that need a higher level of care. They've spoken to a peer a couple of sessions and the peer determines, okay, this person is committed to their recovery and this person is, you know, they're a great candidate for our funded therapy program. And then we are able to match that friend with someone in our little funded therapy network with someone that is going to meet their needs the best. We have different modalities, CBT, DBT, EMDR. So we're really able to match the friend with someone that's going to be successful as their therapist. And having peer support and therapy in conjunction has been very, very successful. We do resource connection and connecting to community partners. So again, finding the tools that each friend needs in their toolbox. Some of the people that are here today are some of those partners we connect people to specifically for seniors. I know Elder Source, who's here today, is one of those resources that we're able to provide to our friends who are needing some additional support. You know, we realize what we do here, we can't be everything to everybody, you know, no one can. And so we want to make sure that we do find those resources people need. And we have an extensive network of over 500 different resources and tools, other organizations, other, you know, support groups, things like that, that people can access and we can connect them to. And then we have support groups. So we have a couple different ones. We have a general one that meets twice a week. You can come either Monday, Thursday, or both. And it's open to anyone in the community. It's a really, really great group of people. It's a safe space just to come speak about mental health struggles. You don't have to be a friend in our program to come to group, although friends can come to group. So it's really open to anyone. We have a support group specifically for LGBTQ+ adults seeking community. And this is a hybrid group that meets on Fridays. We have a group for veterans, first responders, and their families that meets, again, hybrid once on Saturdays. And our newest group is called Sounds of Healing, and it is music focused. So they bring in music to really work through their recovery and process different things. People can come in, share music. That's been important to them. And that's a really cool group we've been able to offer now too. That's hybrid as well. All of these groups are facilitated by a Here Tomorrow team member. There's standards of conduct to ensure it's a safe, comfortable space for everybody. So they really, truly, I mean, it's one of the things I know some of our peers and our team are really proud of being able to offer this to the community. So how are we normalizing the conversation? So we sponsor and table at different community events. Really, the main purpose of this is finding people directly who could use our support. So I try and be all around the community. A lot of what I do as our outreach coordinator is going out to different events, to different places, organizations, and really trying to spread the word that we're here because people can't reach out to us if they don't know about us, right? So we're just trying to find those people that need our support, that have been frustrated with, you know, barriers and not being able to access what they need. We're also at these events to break the stigma, you know, holding conversations about mental health and suicide. There is still such a misconception about it all out there with the general population, and just being out there and having a space to hold conversations about this and have people see the words mental health and suicide is really powerful. And it's really kind of incredible to see, you know, the impact you're making when people come up and say things that maybe, you know, you can tell there's a lot of stigma there, and maybe they leave the table, you know, learning a little bit about mental health and suicide. And then again, spreading the word about our organization throughout the community so people know we're a resource for them, even if they don't need us right now. Maybe they need us a year from now and they know that we're here. We do collaborations with other partners, third-party fundraisers, awareness events, really just, again, trying to make sure we're connected to as much of the community as possible. And we hold a suicide prevention training. So I am the instructor for our suicide prevention training, and it really is kind of suicide prevention 101. It teaches you to recognize the warning signs of a crisis And then what do you do from there? How do you sit down with someone and have a conversation and use the question, persuade, refer model to get them to additional help once you've noticed that maybe there's something going on with them? It's about 90 minutes, and we hold an open session for the community on the first Wednesday of every month here at Here Tomorrow, from 6 to 7:30. And I can also go into organizations, teams, schools, really wherever, and hold a training for you. So if that's something you're interested in, I'm going to put my information in the chat, and there's also going to be a slide with it on there that you're more than welcome to take a picture of. Please reach out to me, and I would love to set that up and talk to you about it. It really is a great way to bring suicide prevention and, helping to break the stigma into your team and your community. Here's some fun pictures of us around the community doing some different outreach events over this past year. Like I said, we really do try and be as many places as possible to reach different parts of our community. So who can we support? Anyone feeling hopeless, experiencing suicidal ideation, or in mental health crisis. Also, anyone concerned for a loved one at risk for suicide. So like I mentioned, back to our founder Joe, who was concerned for his son, we really are here not just for anyone in crisis, but for those concerned for somebody else. We do specifically have a veteran and first responder program. So we have a subset of military peers here to speak to that experience, because that is a very unique experience. And, as peers, our team really, what we're able to do is speak to other people and connect on that level. So we have a team that can do that. Right now, we are only enrolling those 18 and over as a friend for that full year of support, but we have a teen program in progress that will be ready by the end of the year. We have our teen program coordinator, we have our space getting set up, so we really are focused on, trying to get that up and running. But for the senior population, certainly we are serving anyone over 18 right now, and we have friends that are of all ages, all backgrounds. We really are trying to be here, like I said, without any judgment, barriers, discrimination, anything. We are here for everybody. And that is kind of, the core of what we do. So when should you reach out? When you or a loved one are in mental health crisis, when you don't know what to do and need help figuring out next steps. For a lot of other organizations, if you have a patient or you have a client that is in crisis and, that's not exactly what you do, please give them our information, have them reach out to us, help them reach out to us. We are here for them. You don't need an appointment. You can make one if you prefer on our website, but you do not need one. You can simply walk in or give us a call 365 days a year. These are our hours on here, and all of this information is on a handout that should be sent to you after the meeting as well. So really, if you don't know what to do, if you're unsure whether you should reach out, please go ahead and do so. And again, this is our contact information as well as my contact information for you. I'll drop this in the chat, and it should be in the handout after the meeting. But if you would like to, you can go ahead and take a screenshot of it here. So that is all about Here Tomorrow. Hopefully you feel like you have a pretty comprehensive view of when you could reach out to us and exactly how we could support you. I'm going to stop sharing my screen.
Man, that was so informative, and thank you for all that you do and all the information that you shared and the resources. She has 2 attachments. I've just put those in the chat box, but if that's not your thing or you have a hard time getting them out of there, know that we will send those with the post-meeting recording, probably Monday or Tuesday of next week. You'll get that and you'll have those attachments. So thank you. And I think she's going to put her contact information in there also. Grab that. Wonderful organization, and thank you so much. Kathy, if you have a quick question, otherwise we're going to ask for questions at the end just because we got to get through all the speakers. But
it's a very quick question. I just wondered if we're going to, is there any way we can have access to the information in the chat after the program is over? I've been trying to copy it and it doesn't allow me to do that.
Yeah, so Kathy, we will edit that, like pull out all the, hi, here's our blah, 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 that's not important. And we'll get the rest of that to you also in that post meeting. So let me put a note to that. Okay, gotcha. Thank you.
Thank you guys so much.
All right, Claudio, we're going to go to you next. Another important organization that does so much in the elder sector. Claudio, I think you're still here. I know you were having a couple challenges with your internet, but you've got it. And again, if you'll set your timer, appreciate it. And you've got the floor.
Okay, so let's see. I get this. Am I allowed to?
Are you trying to share, Claudio?
Yeah.
Yeah, you
Let
should be able to share.
me
And then
know.
Kathy, just a side note, I don't know if you're able to do it also. You can save the chat. At the bottom, while Claudio's getting ready, I've got the 3 dots that say, do you want to save your chat? And I can. I'm saving it already. I always do for every meeting. So I definitely will get that out to everybody, but you can try it on your own just to see, can you grab it yourself as well? So just an option. And then Kathy, if you want to text in the chat to let me know, did that work or not for you? Good for me to know.
Thanks. Thanks. I'll try it.
Awesome. Okay, great. All right. Claudio, you got it.
Yes, can you see my screen? Yes, okay. So yeah, so I work with Agent Truth, Community Senior Center Services, and we're gonna talk about mental wellness program. And we have presented to this meeting a couple of times, and so I tried to just kind of do a little more focus on what we do as within my program. So a little bit about myself. I'm Claudio Ventura. I'm from Dominican Republic. I moved to the United States in 2008. I got my MSW from Texas in 2015. I've been working with Agent Truth since December 2017, and as a SSW, since 2020. And I am the director for the program since August 2018. So I've been over the program for more than 5 years. A little bit about Agent True. Agent True has been around since 1962. And just a little background, in 1991, we were assigned as the lead agency for senior services in what we call a CCE. For that program, the Community Care for the Elderly. And that's a designated assignment from the DOEA. In 2009, we were named the Self-Directed Care Program, and this is one of the programs that they focus not just for senior. This for anybody 18 years and older that has a mental illness and that we need help. In this program, we help them to pay for services, to see therapy, to see psychiatrist, to get medication or any additional help they need in order to successfully complete their goals in life. In 2011, we changed our name. It used to be Cathedral Foundation of Jacksonville, Inc., and also Urban Jacksonville, Inc. And so we changed our name to Agent True to just kind of reflect more on what we do to help the senior to remain in the community as long as they can. In 2019, we also took over Clay County Senior Services. So now we provide services in Duval and Clay County since that date. So at Agent True, we try to focus on the main 5 pillars, which we call like a healthcare. Within the healthcare, we have a mental health, that's our program. And we also have adult day care, and that's mostly in Clay. For the home care, we provide in-home services, caregiver support, and our nutrition program is Meals on Wheels. We deliver meals to the clients in their home, and we also have congregate meal where the client come to the senior center and they have a hot meal. They're recreational. When we took over Clay County, we also took over the adult day care, and we also have our 4 senior centers. The 4 senior centers, the main one in Green Cove, we also have Orange Park, Middlebrook, and Keystone. And any senior that wants to be enrolled, they just go to the senior center and get enrolled, and they get services. And so there's another way that they can socialize with other senior within the community. And we also have our independent living, which is Intel Cathedral Towers, Terrence, Townhouse, and the new one that we just opened this year is Ashley Square. So before we move on, just a little refresher about what mental illness is. As an APA, the American Psychiatry Association explained, it's a health condition that involves the change in emotional thinking, behavior, or a combination of these. So it just kind of, and as with NAMI, they also, in addition to this explanation, they also focus this, the impact, the main of this, the difficulty within your brain, your behavior, is the impact your daily living. And that's one of the things that triggers us, our individual, to be unable to function regularly as many we do. So focuses more in senior mental health. As Maya share some of this fact, just kind of go along with that. 1 in 4 adult has experienced with mental illnesses, and mainly depression, anxiety, and dementia. I don't know if you guys know, but there's been a lot of talk and research. The population's gonna be double in many years, and also it's gonna double the amount of individuals they are dealing with mental illnesses as well. So knowing that depression is the most common with this program, like I said, like Maia shared, the 85 years and older are the higher suicide rates, the suicide rate, and mostly white Caucasian, all the adults are the higher lead. They successfully complete suicide. Also, the 2/3 of senior and mental illness, they don't have access to those services. As many resources in when you look at over there, I mean, look, more resources is limited. It's very limited for many individuals, and even more for a seniors population. So that's something that I'm glad that we have in this meeting. We had a conversation in order to explore more what other options those clients might have. So the main most common mental health issue in seniors, as I mentioned, depression, also anxiety, and substance use disorder. That's one of the big one in our population, also, as long with bipolar disorder and schizophrenia. And schizophrenia, sometimes if you look within the symptoms, it's also interlap. We kind of like the symptoms similar. So sometimes that's why, in order to identify if the client has a schizophrenia or just dementia, they need to be evaluated. In addition to the psychiatrist, they need to be evaluated by psychologists and neurologists. So it's a combination of those three. They want to identify what exactly is going on with the client. So some of the risk factor worth to mention is the chronic pain or the physical health problem, reduced mobility, social isolation, that's the big one, dementia and cognitive decline, grief, that's a big one. Also, that happens to many a client. Because they're older, they think they're gonna die before the children do. And many times we have many clients within the population, they lost their loved one, mostly kids. And that's a difficult thing for them to deal with. Malnutrition, that's a big one. That's also, we try to those clients to get connected with the Meals on Wheels, where they can get a balanced meal, and they can also know how they can maintain, be able to function, be able to have a good meal, because that's going to be important for the daily life. And another risk is medication side effects. Many are seniors, we have some seniors, they go to the doctor once a week, twice a week, 3 times a week, but we also have some seniors, they don't even go at all. So those are the ones that we need to emphasize and just kind of provide additional education. You need to make sure that you know what you're taking, or just don't even know what a medication's for. So we provide kind of psychotherapy, additional education for them to know, okay, so you need to understand why you're taking, and any side effect that this may cause. So about our program, we do provide the services to any seniors, in addition to caregiver individual, mostly those that are homebound, disabled, otherwise they don't have any access to receiving help. We do provide in-home services, so we go to the client's home and see their the house or any place they might be. We also provide telehealth if the client is unable to meet face-to-face, or they have the flexibility to see a therapy via telehealth. We also have the similar approach, what we call, like, to make sure person-centered approach is an individual. We provide counseling, and we also provide a group sessions. Most of the groups, we have some groups within where the clients live. We have some seniors apartment, so we coordinate with the service coordinator, and we have a group based on the client's need. And this is just kind of supporting the learning ability for them to know what is depression, what is anxiety, how to deal with grief and any losses. So just kind of additional information about our program. We have been providing mental health for more than 15 years, and not just in Duval, but also in other area around Nassau County, Clay, St. John's, and many other those counties. So the main one of the things for the department is just to improve the quality of life of those older adults that might be experiencing with mental illnesses. So who is eligible for our services? Any individual who is 55 years and older. For all the adult, senior, many programs, they need to be 60 years and older. But for mental health, they can be as young as 55 and even younger, because we have a different grant that we can provide services for younger folks that are dealing, and perhaps for the family. If you have a caregiver who is dealing for the mom, caring for the dad, there's like 75, but they don't have any assets or any insurance, they can call us. Even if the caregiver is like 45 or 50 and they need to talk to somebody, they can call us and we can help them to deal with the stress as they care for the loved one. And anybody who experiences any depression, anxiety, many of those changes due to dementia, grief, and mostly one of the main one is social isolation, difficult related to the health, and a change of situation. Many of them, they used to live by themselves. Now they have to live with their loved one, with their son, with the daughter, and that's also a change that's happened within the senior, and we try to help them how to cope with that change. What I go for mental awareness is to identify those undiagnosed, untreated mental health, reduce isolation, reduce depression, anxiety, decrease the caregiver stress. That's one of the main goals. Also, grief, any emotional related issue, in addition to help them to learn coping skill. That's one of, because we're not going to be there forever. So we want to make sure that regardless of what's going on, going forward, they have the skill that will be able to deal with any what happening now and any future event that might come. Let's see. Just try to be mindful. Yeah. So I think that's everything. I just try to be mindful of your time. So yeah. So this is Agent True, and what we do and let me go back to my, so there's our information. You can call our phone number 807-1203. That's our main line. And but also our direct number to mental health is 807-1243. And many times, if you are not available, many individuals from the community who are referred client, they can just call. We just need the client's name, the client phone number, the address, what's going on, and we follow up with the client and to see if they will be open to receive help. And all the services are subsidized. So we have the grant and they don't have to pay anything. They don't have to any insurance. They don't need to, how am I gonna pay? They don't have to pay. These are free subsidized services for senior, the caregiver, anybody in the community that need help. So I just, I sent a link back. Laura, I sent you the handouts. I'm sure you're gonna send, but there's some reference also with the handouts for you guys to take a look if you need to. Cool.
Claudio, thank you so much. And I think I saw you put your contact information in the chat box a little earlier. Is that correct? I think I saw you.
Somebody did.
Yeah, perfect. Yeah. So please feel free to reach out. We've got a couple of handouts, or we've got some information from Claudio we'll share. We're going to try to get it in the chat box. Yep, I think Leah, our Zoom producer, just did that. So you're going to see that in there also. So feel free again to grab that. But if that's not your thing or that's a challenge for you, we will send it post-meeting to you as well. So you'll get that. Again, it'll be by the time everybody gets us their handouts, if Michelle's sending us something, etc., we'll get that out Monday or Tuesday to everybody. So Claudio, thank you so much. Very appreciated. Next, we had Sandra.
Laura, sorry, Laura,
Yeah.
before we do that, there was one question. Does
Yeah.
Agent True serve Volusia County?
So yeah, so we do, however, and one thing, I kind of added and I took it out. Agent 2 is the only lead agency for senior services that has a mental health department. Many of the agencies around the county, like in NASA, they have the senior services. In many other counties they do, but they don't have a mental health. What we do with Volusia, we have a contract with Volusia County, and they refer client to us, and we provide mental health to them. We used to have a contract with Flagler. We no longer have a contract with Flagler, but I know many of the county, they have provided outside the agency. They contract with those providers and they refer their client to them. For us, we see our client in-house, and we are open to have any contract with any other agency that might want to receive for us to provide the services to the clients.
Excellent. Great question. Thank you so much, Leah. Thank you for jumping in there as our Zoom producer helping out. All right. So we are going to move on to our next on the agenda was Sandra. As you can see that something has happened conflict-wise with Sandra. We've tried to get a hold of her in the meeting. We're not able to, so we don't know if she's in Tallahassee collecting the 1.5 billion that maybe she won at Publix at the Lotto. We don't know, but that she was very unbelievably responsive and very excited about being here today. So hopefully everything is okay. Pamela Sanderson works closely and knows what their organization does. So we've asked Pamela behind the scenes if she would just give us about 5 minutes, give us a quick overview of what the organization that Sandra's with does under this heading of mental health. And then Felicia, then we're going to go to you to close us out on the speakers. So Pamela, if you'll take about 5 minutes. Tell us.
Absolutely. Be glad to help. I have nothing, I have no presentation. This is just kind of off the cuff because I did recommend them as a speaker. So, or this organization, sorry. So this, the organization would be the Senior Behavioral Health Department at HCA Florida Memorial Hospital. Most of us just know it as Memorial Hospital. They do have a traditional behavioral health, but then about 5 years ago, they opened, 4 or 5 years ago, they opened a unit dedicated specifically to the needs of seniors. In my work in senior placement, in helping seniors transition to new living arrangements, whether it be independent living, assisted living, memory care, that sort of thing, we're seeing a huge uptick in mental health needs for seniors. And the term seniors really is even expanding. It truly is that 55 and up. There, some of it's, family stress related, etc. But part of my mission, I guess, has been to remove some of the stigma from that, to work with assisted living communities for how they can better serve those who have suicidal ideations, mental disturbances. We're not talking about major mental illness necessarily, because there is a different segment for that. But those who have had depression untreated, that may have, then begun to express suicidal ideations. And the work that's been done at this senior behavioral health unit has been so impressive to me. And I'm very fortunate that we've been able to locate community, assisted living community and memory care community partners who were willing to really look at this person as a whole and not simply at this incident that has occurred in their life, this crisis that has occurred in their life, and to find out how they can really help them get on a healthier footing. So, besides, a lot of people, if you've ever visited some inpatient mental health centers, many of them have been hospitals' dirty little secrets. They're poorly funded, and it's sort of a warehousing while we're waiting for medications to take effect, and that's just not enough. So having great programs for group therapy, for individual therapy, medication and treatment regimens that are really state of the art. I've helped families who have had their loved one brought over from the Gulf Coast of Florida, specifically to come to this behavioral health unit to get treatment and then to move on. We have, been very fortunate, like I said, in finding community partners to help. So I would really encourage any of you who have loved ones, clients, friends, strangers, anyone that you can help that does need an inpatient behavioral health to really reach out to HCA Florida Memorial. Their intake is done through their emergency room, so it's no special magic. The person would have to present to the emergency room, and then if they're clinically stable, medically stable, then they can be transitioned inpatient. They are a Baker Act receiving facility, but there are plenty of residents who are there on a clients, I'm sorry, who are there on a voluntary basis. So I give you a little bit of a
Perfect, Pamela. Thank you so much for jumping in. I appreciate it again.
welcome.
Sandra was very excited about joining and immediately said yes, and
Yeah.
all of those kinds of things. So again, hopefully everything's okay, and it was a schedule mix of some sort, and everything's good. So if I do get
I hope
anything
so
from
too.
her, we'll include it in the post meeting information. So Pamela, thank you for jumping in.
Thanks, Laura.
All right, so we're gonna go to Felicia. Felicia, you got us till 10:25. So if you'll just keep an eye on that at 10:25, we'll wrap up, do our wheel of names, thank our a couple of folks that we need to thank here, etc. So Felicia, you've got it. I see Felicia is still with us. Let me see. Do we see Felicia on here? She's in the meeting room.
We can
Sorry.
see Felicia.
Hey, hey.
I was talking and I was on mute.
I couldn't quite see your photo yet. I had things condensed for the Claudio's presentation. So I'm just happy that you're here and you got till 10:25. We're very happy that you could join us. So thank you.
Perfect. I'm sharing my screen. Let's see here. Okay, can everyone see my screen?
Yeah.
Okay, perfect. I'm going to go through some of this briefly because I don't have a lot of time. So my name is Felicia and I'm a suicide prevention coordinator with the VA. So a part of my role is we manage and monitor veterans who have been identified at high risk for suicide, and how we come to know about those veterans. Sometimes those veterans who have been hospitalized in a community hospital, as we don't have a VA hospital in Jacksonville. So we have a nurse who reaches out to those community hospitals, or the hospitals actually reach out to us to let us know that, hey, we have a veteran on our inpatient unit. And so we work with them after the veteran has been discharged or just before discharge to get them connected with post-discharge appointments. And so if they are in need of a high risk for suicide flag that is placed, we monitor that individual, just making sure that they're connected to mental health services, have all of the support, whether it's, again, with mid-management, psychotherapy, we have whole health groups, and we have an SP telehealth psychotherapy program as well. And then we review those flags every 90 days to see if the level of acuity has decreased. And if so, we inactivate that flag and we still reach out to that veteran periodically just to make sure that they have support in place. So again, I'm just going to briefly go through some of this just to provide some information. This is our SAVE training that we provide not only to staff within the VA, but to a lot of our community partners as well. So we know that suicide is a national public health problem. It's not a local problem. It's not a citywide problem or a statewide problem. It's a national problem. And we're seeing rising rates of suicide, not necessarily just among our veteran population, but within our general population as well. So I was doing a training yesterday and we talked about this next bullet, is that for every death by suicide, there are approximately 135 individuals that are impacted, which says that if an individual has died by suicide, it not only impacts their immediate family or extended family, it impacts, peers, maybe colleagues that know them, maybe individuals that they served with, maybe even the providers, medical providers or mental health providers. So it is far reaching and it impacts a lot of different people. Again, as it said, so suicide is a really complex topic. It's not just one specific factor. It can be a multitude of factors at all different levels, individual, community, and societal levels. And as it was mentioned earlier, they talked a little bit about risk factors and protective factors. The idea is to be able to decrease those risk factors and maximize or highlight those protective factors that would prevent a person from acting out on thoughts of self-harm. So as you can see, these are a list of our risk and protective factors. So with our risk factors, anyone who has a prior suicide attempt, for our veterans who have had multiple combat deployments, that can definitely put them at an increased risk for suicide, because a lot of individuals may have a sense of guilt or shame or survivor's guilt for the things that they did while they were serving in that combat zone. Access to lethal means is big among our veteran population because most of our veterans do have access to firearms. And so we strongly talk about lethal means safety with firearms, or even when it comes to something like medication. We do pass out gun locks. I get them by the, I'll say like thousands, if you will. So if anybody is interested in, me sending out gun locks for you to be able to distribute, and it does have the Veterans Crisis Line number on those gun locks as well. I think grief was mentioned as well. So anyone who has experienced loss or grief of a loved one or a peer, a lot of veterans have difficulty when they have peers that they served with who have died by suicide, and they're really struggling, especially when it comes to the anniversary of those deaths. Legal or financial challenges, relationship issues, unemployment, homelessness. A few other things that are not noted on here. Chronic pain is a big one. If you've been in chronic pain long enough that it's starting to disrupt your sleep and disrupt your quality of life, that can definitely put one at an increased risk for suicide. And then on the other side, we have our protective factors. So at the VA, we have same-day access, which means that a veteran could present to any of our outpatient clinics. We have 3. We have one at Jefferson Street, which has eligibility and enrollment, primary care. It does have some specialty services. It is not a mental health clinic, but they have mental health established within the primary care teams. We have one at South Point, which is across the street from St. Vincent Southside. That also has primary care, specialty care. It does have mental health care there. And then our university clinic, which is next to Memorial Hospital, that has, again, primary care and mental health. So they can walk in at any point to speak with a provider same day to address those needs. A sense of belonging. So we know that when veterans separate from the military, that sense of connectedness or belonging sometimes is missing. And so having groups within the community that are veteran-centered, or groups that we offer within the VA, is very important. Just to kind of go through a few, mission or purpose, sense of spirituality and religion is a common one when talking with veterans, as far as what is your protective factors, what are the things that would prevent you from acting out on thoughts of self-harm. And religion and spirituality is another one. Things like child care responsibilities, individuals who have children, maybe it's an older veteran who has grandchildren, right? And so I just talked with a veteran who had twin grandchildren, and they were about to turn 1. So that was a protective factor for him. If physical health, if you're in good health, that is definitely a bonus. Employment, social and emotional well-being, and just a few things that are also not noted on here is pets. Pets plays a huge role in an individual's life, and that can definitely be a protective factor. So I won't go through all of these numbers and slides, just a few things. So when we look at the breakdown, firearms is the #1 used method in regards to how people die by suicide. So as you can see, among our veteran population, it's just about 70% compared to our non-veteran population. You can see that for veteran men, it's 70%, which is relatively high. Then you can see the other means of death by suicide as well. We talk a little bit about lethal means safety with our providers and what that looks like. Again, we provide gun locks. We have pill boxes that we provide to agencies. and things of that nature. And we provide this information to veterans as well. It's veteran-centered, it's collaborative. How can we work together to make sure we come up with a good plan in regards to lethal means safety? So I'm just going to jump through because I know I don't have a lot of time. We know that suicide is preventable. I'm going to stop sharing my screen here because I know I don't have enough time. Here we go. If anyone is interested in me providing a SAFE training, so there are about 13 suicide prevention coordinators. We cover all of North Florida and South Georgia, which is huge within our system. We are more than welcome to come to your agency, provide training. We have lots of Veterans Crisis Line swag, gun locks, pillboxes, Veterans Crisis Line cards. So if anyone is in need, I can definitely stop by and drop off that information or those items to you. I definitely thank you guys for just letting me ease in and get a little bit of chunk of time to talk a little bit about what we do within the VA.
And Felicia, thank you. And again, apologies. We had the whole program set and everybody was timed. And then we heard of her and what she does. And we started interacting with her. It's like, all right, let's at least get her on here so people can reach out to her. And I think, Felicia, you just kind of talked about that you are willing to go do presentations, the full presentation, and be a contact and a resource for folks. So again, we appreciate you jumping in and being willing to share that. So hopefully people will reach out that know that would be a great benefit for them to have that resource. So I think, Felicia, you put your information in there. I did put your handout in the chat box as well, and we will include that as we send out that post-meeting information. So a huge thank you to all of our speakers today. Pamela, again, thank you for jumping in for the HCA Florida Memorial. We really appreciate it. And if you are on this list, if you will please give us a wave. I know some of these folks are here. Eustachius, I hope I say that correctly. You can see him down there. Pamela's here. We got several folks here that do this behind the scenes. They determine what the topic's going to be. They find the right resources. They reach out to their network, etc. So a huge thank you to them. That's how it all happens behind the scenes. And again, Gabby does double duty. She sends out the emails and everything to everyone else. On a sad note, to wrap this up, which is not an ideal situation, but when is a good time to do this? It's really not. On that list for many years that I just showed you was Eileen Rodden, and she was with the Women's Center, and unfortunately she passed away from breast cancer, as you can just see, just a few weeks ago. In the chat box is her obituary. I think Leah's putting that in there for us. There's also a cancer focus initiative coming up that if you want to join the team, either to support Eileen or cancer research or whatever it might be. And I'm going to also put that in the LinkedIn group because I know you don't have a lot of time right now to grab everything, but we'll include that in the chat notes that we're going to send out Monday or Tuesday also. So we will miss her. She was awesome. If you were lucky enough to know Eileen, you know all the wonderful things about her, and still doesn't seem real. She just was just a sunshine all the time and glass half full, and she just was just a wonderful person, and it's just a sad situation. So Eileen, you will always be missed. So all right, so let's wrap this up. Let's do our wheel of names. We'll do that in just a second. Leah's doing all that for us behind the scenes. So we have one last meeting date. It will be virtual, and it will be November 3rd, as you can see there. We will be getting out in December, the 2024 dates. We're hoping to be in person in January. That's the goal. Join the LinkedIn group. If you haven't, you'll find each other, and you can also post those same kind of things that you saw in the chat. Great conversation in the chat going on, all kinds of posts there. So I am going to stop sharing. Leah is going to spin the wheel and share her screen. Congratulations, Felicia. See, there was a reason you were supposed to be here today. All right, who's our second winner? And Nancy, I think you're here too. Nancy. Awesome. Okay. So for those, Leah, thank you so much. For those two folks who just won, I will contact you after the meeting. I'll get you set up with Michelle. our sponsor, and she will get that $25 Amazon gift card to you. So thank you everybody for coming today. I hope you have a great rest of your week, and I hope these resources never come into play for you or anybody you know or love or whatever. However, we know that's not realistic. So it's wonderful to know that all these great organizations and people are out there that care and want to make a difference in everyone's lives, especially those under crisis. So thank you, and I hope you have a good weekend. Go Jaguars. See everybody hopefully in November.
Thank you.
Thank you.
Have a good day.
Thanks, Leah.
Thank you so much.